Good afternoon. Welcome to week 11 of the EMA COVID update. For those of you who are keeping track, day 530. Joined here today with Mila Blanford from the Health Department and also Chairman Mark Kern. As I said, week 11, and we got more numbers for him to report, Mila.
We do. For the reporting period of August the 19th through the 25th, we have a total of 773 new positive tests out of a total of 8,795 for the reporting period. The age range of those positive individuals was under 10 to in their 90s. The weekly county positivity rate is at 8.8 with the 7-day rolling average match at 8.8. The regional positivity rate was at 8.5 as of August the 22nd. Unfortunately, we have 7 new deaths to report. We have 4 males, 1 in his 50s and 3 in their 70s with both known and unknown health conditions. We have 3 females, 1 in her 60s and 2 in her 70s with unknown and known health conditions. Countywide, we have conducted a total of 425,119 tests, consisting of 36,385 positives and 388,734 negatives. Total number of deaths to date is 508, and our condolences go out to those families. To date, the number of individuals who completed their 10-day isolation period is at 34,738. Statewide, we've conducted a total of 28,393,030 tests, consisting of 1,499,022 positives, and that's an increase of 24,737 from last week. Total deaths to date is 23,816, and that's an increase of 131 from last week. St. Clair County hospitalization numbers. The total number of hospitalized patients in St. Clair County with COVID-like illness is at 75. Regionally, we're at 152. Patients on ventilators is 5, and regionally, we're at 16. Now, we've had some questions on the last briefing about hospitalization numbers. The numbers that I just read were as of this morning. On the way over here, the hospitals had got together and provided an infographic that we could show to help answer some of those questions. So Randy has put that up on the screen. This is a collaborative between Touche Memorial and St. Elizabeth's, and they wanted to be able to get this information out to you. So the number is updated since this morning. We're at 70 hospitalized, and you can see that 50 of those individuals are unvaccinated. We have 18 in the ICU, and 15 of those are unvaccinated. And we have 5 patients on ventilators, 4 of which are unvaccinated. So I think that's a good visual graphic to let everybody know where we're at here locally with hospitalizations. And we appreciate our hospitals for doing that for all of us. Okay, for congregate care, we'll announce those that are in outbreak setting. Caseyville Nursing and Rehab, we have 3 new cases. Freeburg Care, 2 new cases. Gateway Foundation, 4 new cases. Integrity Healthcare of Belleville, 1 new case. Morningside of Shiloh, 1 new case. And St. Paul's Home, 2 new cases. For testing, St. Clair Square continues to offer testing Monday, Wednesday, Friday, and Saturday from 8 to 4. In addition, they do offer vaccine. You can receive Moderna, J&J, or Pfizer Monday, Wednesday, Friday from 8 to 4. You can drive up to the testing area, and then they'll separate those out who want to receive vaccine. So that's good information out there for everybody who's out and about. We continue to offer vaccine at 330 West Main 6 days a week. And again, we offer all 3 choices, including that 3rd dose for those who are moderately or substantially immunocompromised. And if you have questions about what that means, you can look on CDC's page, or you can reach out, and when you get to the site, some of the medical professionals there will assist you. In addition, we know that FDA issued full authorization for the Pfizer vaccine on Monday, so hopefully, if that was one of the lingering issues people had to receive vaccine, they'll take that information and go and receive their vaccine. Again, they submitted this week for an approval for 3rd dose, so we hope to see that being administered sometime mid-September, last that we heard. And then the younger age groups will follow as more data becomes available. We started that 12 to 15 age group back in May, so we think those will follow in coming weeks. Okay. And then for our Delta and our variant information, we're at about 77% of those variant cases reported to the health department are now a Delta variant or a sublineage, and about 22% are the Alpha. So we can see how that trend has increased over the last few weeks. We continue to see testing going up across the area. And if you have any information about where you can be tested, again, you can go to our website or Facebook page, and we have all that information out there, as well as where you can receive vaccine. And I think we have the age breakdown again, Randy, as well. So we can see similar to last week, we're about 56% under the age of 40 and 25% under the age of 21 here in St. Clair County for the breakdown in positive cases. Chairman Kern?
So, and I know we didn't talk about this before, I don't want to put you on the spot, but
That's
what's the difference between the Alpha variant and the Delta variant?
So they're both variants. The Alpha was one of the first variants that we had seen. The Delta is more recent. We know that it is more contagious. It spreads easily. And we think that's why we've seen this increase in cases. Now there are some sublineages of the Delta variant. There's AY3 and AY4. We have both of those. We know that across the nation we're seeing an increase in the Delta. And right now we're at about 77%.
Are any of the variants perfecting this virus even more to where they become more contagious and more dangerous? Or are we seeing just kind of a general plateauing right now, but new variants I'm sure being created that we don't even know about?
Right. Well, as long as we have individuals who are unvaccinated, that virus wants to survive. So you'll see mutations, you'll see new variants. And obviously those that are more successful in competition will become more prevalent in the population, which is what we're seeing in the Delta.
And the number you talked about, 25% of the cases now are under the age of 21, and 18% are above the age of 60. So this is totally
Different than we've seen in the past, but we see
flip-flop.
more vaccination in our older age groups as well.
So get vaccinated, and let's talk about booster shots for a second. Are
Right.
you seeing? Are we getting a lot of interest in boosters? And
We are. Right now it is for the moderately and severely immunocompromised, which may mean that you've had an organ transplant or an immunosuppressive drug. And again, our healthcare professionals can address your questions at 330 West Main or wherever you go for that. I know St. Clair Square will also issue those third dose boosters. I believe HSH as well. You could give them a call. But yes, we do see several a day, obviously not large numbers, but as we get approved for everybody in that third dose group, hopefully mid-September, we expect to see a large uptake in vaccine.
and everybody means that 8-month window has
Right.
gone by, and they are eligible then.
Right, so for your third dose, if you're immunosuppressed, they want 4 weeks after your second dose. And then with the third dose boosters, they're going to go 8 months after your last booster dose or your last dose of vaccine. So we'll start to see it again mid-September, because as you remember, we started vaccinating in December and January in the county with those healthcare professionals. So again, those doses will become due the first, and then it'll move through the fall.
Okay, thank you, Mila. Okay, let's take a look at the zip code report. Once again, we've got a lot of numbers in the zip codes, but on the brighter side, we are better than we were last week. So let's take a look at these numbers. 62201, we're up 25 to 741. 62203, up 13 COVID positives over the past week to now a total of 817. 62204, up 9 to 540. 62205, up 17 to 848. 62206, up 47 to 1,818. 62207, up 24 to 836. 62208, up 58 to 2,091. 62220, up 62 to 2,622. 62221, up 88 to 3,463. 62223, up 43 to 2,216. 62225, up 8 to 205. 62226, up 67 to 3,949. 62232, up 14 to 1,065. 62239, up 15 to 593. 62240, up 8 to 214. 62243, up 12 to 885. 62254, up 16 to 922. 62255, up 6 to 112. 62257, up 22 to 424. 62258, up 37 to 1,316. 62260, up 12 to 920. 62264, up 3 to 426. 62269, up 77 to 4,042. And finally, 62285, up 16 to 665. Regional positivity this week is 8.5%. Last week, that was 10.2%. So we have taken a downturn, which is a good thing. And the county 7-day rolling average is also down this week to 8.8%. And if we remember, last week it was 11.1%. So it's down 2.3%, which is the right direction, Herb, but we still had 7 deaths this week. Last week we had 8. That's still way too high a number, and it can be avoided if people get vaccinated.
Way too high. You know, there's some people who are out there waiting all this time saying they were waiting for the FDA approval. Well, now there's no excuse. That's been done. So I hope that we don't see individuals looking for another excuse because
so
there's
Pfizer and FDA, they take a hard look at before they do any of that, and they certified the Pfizer vaccine. Supposedly, Moderna and Johnson & Johnson is coming within the next 30 days. And so there really are no more excuses that people can have.
Exactly. 2 things, Randy. Make sure we get the COVID hospitalization and one of the questions on here from one of our followers. If we could put that on our page. Okay, it's already posted. Good. Thank you, guys. And then John, another one of our followers, just joined. Can you sign up now for the 3rd booster shot from Pfizer? And I think you mentioned that there is no sign up. And if you would explain that right one more time.
So at 330 West Main, you can drive up without an appointment on any day, Monday through Saturday. Monday through Friday is 10 to 6, and Saturday is 8 to 4. And you can receive any one of your 3 vaccines. But if you're looking, for that booster, you can drive up and you can talk to one of the healthcare professionals to see if you qualify. And then I believe as well at the mall you can receive it, as well as the HSHS location, I believe.
Okay.
In my a friend lost their card, and they called and said, "What do I do? I'm going to be traveling. I need my card to be able to prove to get on an airplane, to get into venues." Can people get a replacement card? Do they have to have gotten vaccinated at the county to get that? Or
No, and you can reach out. One on Vax Verify, it's a statewide online system. You can put your information in, and it can print out all of your immunization records. So that information is on our Facebook page and our website. You can write into IDPH or email them. They have a location, an email address where you can get information. It takes a little bit longer. The fastest way is Vax Verify. If all else fails, you can call the health department and we can assist you with that as well.
so if they've got a time crunch, I'm leaving tomorrow and I can't
Right.
find my card, as long as they're within your hours, they could get some help.
Yes, potentially, and Vax Verify is online, so that's 24 hours a day that you could access your information. You do have to go on and set up an account and put your information in, but then you can print all your immunization records, so it's a handy tool to have.
Great.
Well, and once again, we want to just thank the hospitals for providing this, because I think this graph right here, and it's up on our page now, will show those numbers are astounding. And when you look at hospitalizations, as we've heard, Dr. Wade was on, and Mike McManus has been on, and we keep talking, our healthcare providers out there, our first responders are wore out and they need a break. So we want these numbers to go down, and we can do that by people getting vaccinated and helping be a part of that solution. So that's our report for week 11, day 530. Hopefully this trend we're seeing going down this week will continue, and it will if everybody steps up to the plate and gets vaccinated. We'll see you next week. Thank you.